Reducing wrinkles and removing cellulite are two of the biggest priorities for men and women who want cosmetic procedures, and there are two new ones that are about to hit the market.
So joining us around the table to talk about it is Dr. Sabrina Fabi. This is right in your lane, girl.
I know.
Right?
I just got back from one of the largest world conferences on aesthetic surgery and these non-invasive procedures. And so these are two products that a lot of people were kind of talking about because it's kind of what's coming, what's going to be coming to market.
Okay, so let's talk about the first one, reducing wrinkles.
Yes. And so this is a product by Revance called RT002. And so it's essentially the same form of botulinum toxin A that we've been seeing in others like Botox, Dysport, Xeomin. But this one has this unique peptide that they think contributes to it possibly lasting a bit longer. And so in the clinical trials that just came out, their results just came out in one of the open label trials, they found that the median duration was about 28 weeks, which is almost about 7 months.
And what does a normal Botox one last?
Yeah, so usually what we see with other toxins is that it can last maybe about 3 to 4 months when it's dosed the way that it's presently approved. And so because of that, we know that right now the market penetration has really only been about 10%. But when you poll a lot of women, the thing that concerns them the most that's contributing to their age is wrinkles. And so there's been a discrepancy as to why is it such a big concern, but why aren't people doing enough about it? And perhaps one of the answers is the longevity of these procedures.
Because then you know you have to keep getting it done over time. You know, our news director tells me don't make the crunchy face like this because he doesn't want me to get wrinkles. He's like, stop making crunchy face.
So is there anything else like this? I mean, is this unique, or is it just because it's the length of how
right, so it
work?
is unique in the way that it's been formulated, definitely. And you could potentially increase dosing with some of the others to get longer results. But what makes it unique is that this, a single dose, can actually give you these results, and the side effect profile is very similar to the other ones that are on the market, which is great. That's something that we always look for when we're looking and evaluating a drug.
Let's talk about that safety. So what are some of the side effects that people need to be kind of aware of or may have concerns about?
Yeah, so what we've seen with all of them pretty much are headaches are usually the most common, and that's at about 3%. Obviously we have to inject it, so that's the use of a needle, and that can potentially cause a little bit of pain upon injection. And then bruising because of that injection. So those are usually the most common side effects with all of these.
Hasn't Botox, though, been used for people who have severe headaches, too, to help them?
It's interesting. So one of its indications is for chronic migraines, and it's just injected in a different pattern in order to achieve that result. So I know it sounds a little bit...
Right, kind of counterintuitive.
Yeah.
All right, let's talk about cellulite. This is, I think, probably more so for women than men, but men obviously still concerned about cellulite.
Right,
Not you, Andrew?
Sure.
Okay, what are we talking about for cellulite that's out there?
The very reason why I decided to cover this for you today, Andrew. No, but this is something that affects 85 to 90% of women, and so the reason is multifactorial. But there's thought to be these little tethers that hold that skin onto underlying muscle, and so presently we have an excellent treatment called Sulfina that can cut those tethers and release the dimples and improve cellulite by at least 50% in a single treatment, and that can last quite a bit. But what we're seeing is that people sometimes just want a quick procedure, maybe 5 minutes that you can inject and do at the bedside. And so that's this particular product. It's called CCH for short, but it actually is unique in that it's coming from an enzyme made from a bacteria, Clostridium. And so upon injection, it has been found to improve the appearance of cellulite, but you do need 3 treatments in order to get those results.
And really quick, because we've only got a couple seconds, are both of these available right now for people?
They're not. So they've completed their phase 3 clinical trials and hopefully will be out on the market within the next year or 2.
Interesting. We'll keep an eye on it for them.
Yes, we will.
All right.
Duly noted. Thank you.
Dr. Fabi, thanks.
Thanks for having me.